Hello, everybody. My name is Frances Castaneda-Dice, and I am a proud board member of the Mayor's Hispanic Advisory Board. I'm also president of the Houston Easton Chamber of Commerce, and we're here at Houston Media Source, and it's an honor to welcome you to this wonderful program. I had the honor of meeting and working with Sofia Adrogué. She is also a board member and chairing of this committee that brought this together. It was her idea, and she loves the health and wellness of the Hispanic community here in Houston, and I think no other better way for her to put this group of leaders, doctors together to talk about this important topic, the health and wellness of Houston Hispanics. So it's my honor to introduce you to an amazing leader, an amazing philanthropist, Sofia Adrogué.
Frances, I'm absolutely thrilled, fellow TW Woman on the Move, and this is indeed an honor. Look forward to introducing to you the healthcare professionals that are with us tonight. At the outset, just a little bit about the Hispanic Advisory Board. It serves as a liaison between our community, Hispanic community, and all of our community, and the mayor. With us on the studio, and so proud, is Lenora Solomon-Pullman, and she is absolutely, she is absolutely a leader in our community, the co-chair of the Mayor's Hispanic Advisory Board, along with Roland Garcia, and also with me, who also is part of the Mayor's Hispanic Advisory Board, and the co-chair of the Appointments Committee, Rose Salas. And we really are thrilled to be here today. Before we turn it to the healthcare professionals, a few things that need to be said about Houston and the dynamic city that we are. We've got a PowerPoint. If it has the luxury of rolling, that would be incredible. But as we see the PowerPoint rolling, we'll turn to the first one, and let's talk about who we are as, going to the next, who we are as a city. We are the city of the future. If we can go to the fact that we're 145 languages stated and learned and spoken here. 1 out of every 4 of us are foreign born, and we truly are, going to the next PowerPoint, the city of the future. And absolutely, we're also at the epicenter for healthcare, and that is what's so amazing. Not only are we the city of the future, what does that mean? If you were to look at demographically what Houston will look like in 40 years, according to Dr. Kleinberg of Rice University, it is who we are today. But beyond that, we are at the epicenter for healthcare. And why is that? Because the Texas Medical Center, and here we go now with 145 languages, and it is, of course, the 4th largest city in the country. Thinking about the Texas Medical Center, it is the largest medical center in the world, and a destination for so many. As we contemplate for a moment what's transpired with COVID, we know it was an epic year, a historic year. It's been known as an annus horribilis. And who do we have to thank but the medical community? As we turn momentarily and talk about vaccination, I would also encourage all of us to be thinking not only about the physical ramifications of what we've dealt with, economic, of course, but also the health and mental ramifications. It is not surprising that experts have said that what we have had to go through mentally, i.e., what we are dealing with internally, is a combination of Hurricane Harvey and the 2008 recession. So truly, as we turn to the medical experts and thank them for everything we've done, we've got to be cognizant that we'll address the vaccination, and ideally we'll all have the luxury and take advantage of the opportunity. But don't forget your mental health. What is fascinating as I turn is our U.S. Surgeon General, that is the nation's doctor. Even prior to COVID, he talked about that it was a nation of humanity that was periodically quite lonely. So I would just ask you, not only on my behalf, our entire committee, that those that have worked tirelessly, and of course on behalf of Lenora and Roland and Rose here with us, to please not only contemplate vaccination, but take care of of yourself mentally. Without further ado, I'm so blessed to have met and had the luxury of work with Dr. Lopez. She is the only physician on the Mayor's Hispanic Advisory Board. Welcome, and I'd welcome you introducing, saying a little bit about yourself and our colleagues here today. Thank you.
Thank you so much for the introduction. So my name is Kayla Lopez, and I am a pediatric cardiologist at Texas Children's Hospital. I also am the medical director of the cardiology transition program, so I work a lot with teenagers and I do a lot of imaging in the hospital as well, and have been able to see a lot of things going on in that space in terms of teenagers, in terms of effects of COVID on teenagers and on youth. And we'll be talking more about that today. To Sophia's point regarding mental health and the importance of mental health, I just want to point out, if you feel that your teen is in trouble, if you feel that your child is in trouble, they're disengaging, they're doing worse in school, they're not as social, they don't feel like talking, the crisis hotline, www.crisishotline.org, is a wonderful resource in Houston to be able to use, to be able to get resources for your child, for your teenager, and frankly for yourself if you need it, given the mental health crisis that has kind of come upon us amidst COVID. So without further ado, I'll have my colleagues, my wonderful colleagues, introduce themselves as well. And as Sophia mentioned, that I am also a member of the Mayor's Hispanic Advisory Board, and I'm thrilled to be a physician on that board, to be able to talk about some of the issues that are impacting us in the medical center and in all of Houston as well. And so I will turn to my colleague here, Dr. Flor Munoz.
Hi, Kayla. Thank you so much for the invitation, the opportunity to be here. So my name is Flor Munoz. I'm a pediatric infectious diseases specialist, also at Texas Children's Hospital. And I work in different aspects. I do take care of our patients that come to Texas Children's with COVID and with other illnesses. I am an investigator, so I do research in vaccines, currently conducting some of the studies in children for the COVID vaccine, and also antivirals, therapeutics, different ways of trying to address this particular problem in children. And I work also in the clinical setting, taking care of patients with transplant. So I'm the director of the Transplant Infectious Diseases program in our hospital.
And go ahead, Dr. Aguayo.
Thank you. So I'm Dr. Felipe Aguayo. I am currently an assistant professor for Baylor College of Medicine and Emergency Medicine. I work clinically as an emergency physician in Ben Taub General Hospital, where you can imagine that I'm exposed to many patients as they come in with their initial presentation of COVID-19, and I'm the one that takes care of them at the beginning of the process and determines who can go home and who needs to stay in the hospital for further care.
Well, doctors, thank you so much. We can only imagine what you have experienced, the angst, the mental and physical human angst that you've seen of others, and obviously you've experienced. So thank you for all we do and you have done. Dr. Lopez, I'll start with you, and I appreciate you referencing not only the pandemic, but the epidemic within the pandemic. And absolutely correct, whether it's the teenager, the child, or the adult themselves, they have to be cognizant that they too may have some questions or some things that they need to be thinking about. The first question, Dr. Lopez, to you is, what do we need to know about the current COVID transmission rates among teenagers, and your thoughts as to how to address it?
So what we know is that there is an increasing rate amongst teenagers, more recently described. The Center for Disease Control has more recently described an increase in the rate. And in the most recent review between March and April of 2021, they found that of the teenagers that have contracted COVID, about a third of them needed to be hospitalized, and about 5% of them needed to be admitted to the ICU and intubated. And so that is a real issue, and that's particularly concerning now that a lot of states are reducing a lot of the restrictions that people had, a lot of the mask mandates, a lot of the mandates that they had in place in schools. This is particularly concerning given some of the new COVID variants that we are seeing in the world, frankly, and now rising in the United States. So there's a newer COVID variant, the Delta variant, which initially I think was described in India, and that variant is now on the rise in the United States, and that variant is thought to be 60% more transmissible or more contagious than the prior variants, the variant from the UK, the Alpha variant. And additionally, it is thought to actually end up in having twice as high of a hospitalization rate. So if you take that information and you take the relaxation of restrictions, and you take the fact that cases were rising in March and April in teenagers, it is somewhat concerning, particularly as we enter into the summer, when we think about what teenagers are going to be exposed to, what they're going to be doing, who they're going to be hanging out with, whether or not they're going to be socially distanced and masked, particularly if they are not vaccinated.
Thank you so much for that. Dr. Munoz, then it goes without saying, then the next question would be, is the COVID-19 vaccine safe for teens?
Absolutely. Not only the vaccine is safe for teens, it is safe for adults, it is safe for the population who is being vaccinated right now. And we are working, as I mentioned before, towards having a vaccine for younger children as well. So the vaccine has been given to more people than any other vaccine in the past. If you can think of any other infection for which we have a vaccine that has now been given to billions of individuals, not just in the United States, but globally. Granted, there are different vaccines. The fact that we have so much data collected now regarding how safe the vaccine is very reassuring. It's also important to know that we have safeguards in place. So there are systems in place, especially in the United States, where surveillance exists to try to identify even rare events that could happen after vaccination. And fortunately, I have to say, in this country, we have the safest and the most effective vaccines. We are very fortunate to be able to have high coverage at this point, increasing coverage with a vaccine that works so well. So it's very effective, and the data continues to accumulate with no significant signals for any concern for safety. There could be, obviously, some signals that could show up, but that is exactly why these vaccines are under surveillance and continue to be under emergency use authorization. And the data is very much out there. So as you have seen, the process is very transparent, and it should be reassuring for all of us that these safeguards are in place and that we are the first to know the information that the CDC, the FDA, and other regulatory bodies are reviewing and giving us information about.
And let me say the following, Sin, that was an incredible answer, but just bottom line, yes and no in ages. So if you have a teenager, first of all, how are we defining teenager? So 13, and then so if you have a teenager, if you could give us the ages, and is the answer yes, try to get a vaccination?
Yes, so teenagers would be your 12 to 19-year-olds, as a matter of fact, and we have had vaccine available for 16 and up earlier, and now for 12 years and up. So yes, please vaccinate your teenager. As we have heard, I'm just going to add that they are coming to the hospital. We are seeing teenagers with other comorbidities, so other underlying medical problems similar to those of adults. And we also know that the vaccines work just as well for them as with adults. And so it is the time. We've been waiting for this for a long time since the pandemic began. It is time to vaccinate our teenagers.
And thank you. And for the record, I have teenagers and they have been vaccinated. Doctor, you referenced at the outset with your introduction the number of things you've also seen, including in Bentop. So are you still seeing cases of COVID-19? And then the other aspect of that question is, do you see a more disproportionate effect or numbers coming in that are from the Latino or African American community?
Indeed. The pandemic's not over. We're still seeing cases at Bentop. We're seeing the whole spectrum, from mild cases which are able to go home with isolation precautions and just kind of ED return precautions come if your symptoms are worsening, to the most severe cases that end up hospitalized in an intensive care unit receiving aggressive care of all ages. I'll see 20-something-year-olds, I'll see 60-something-year-olds. Sure, as a sigh of relief, the cases have definitely gone down. I am no longer seeing this all day, every day, but it is far from over. As for the second part of your question about the disproportionate, well, it's a little hard for me to answer because working at Bentop, the population I work with is already disproportionately Hispanic and Black. But I rarely see Caucasians with severe illness. I also rarely see, if ever, patients who have been fully vaccinated coming into the hospital requiring admission to the hospital. So they might have been vaccinated, might have contracted COVID-19, but they're very, very well appearing, able to go home, and they end up doing very well. as for data, the Texas Department of State of Health does have a lot of information that does prove to this disproportionate effect to Hispanics and Black communities. Approximately 36% of all cases have involved Hispanics, are in Hispanic populations, whereas 46% of all deaths are in Hispanic patients. So that can tell you that an unaffected Hispanic person is more likely to have a poor outcome when compared to their white counterparts. And there's a lot of things that can explain this. Hispanics are at a baseline at a higher risk of having poorly managed medical conditions because of poor access to medical care, not enough money to actually reach medical care. They don't have insurance. So they might have the same medical conditions that their white counterparts have, but they're not well managed, they're not optimized. So they're starting off at a worse health baseline. Then once they contract COVID-19, they are just more likely to have a poor outcome or succumb to the disease.
Thank you very much. And so it sounds as if you would also agree with Dr. Lopez and Dr. Munoz to please, if you have the opportunity, make it your mission to be vaccinated and have your teenagers vaccinated.
Yes, 100%. We're also seeing disproportionate vaccination rates. So in the state of Texas, about 52% of the population is Black or Hispanic, but only 42% of the vaccinations have been to that population. That gap is closing according to the most recent trends, so we're on the right path, but we just got to get there faster. So I definitely encourage you to go get your vaccine as soon as possible. They're readily available now. Try to get all the information you can so you can get the shot whenever.
Thank you very much. And Dr. Lopez, this is a little complicated, but perhaps it's an outlier, but we have to ask the question. The teenagers perhaps can have a heart infection or reaction because of the COVID vaccine. Is it true? Who potentially could this be happening to? I know this is a little bit of a tough question. What are your thoughts?
You know, first I'd like to state that the rate of any sort of a reaction to any sort of a vaccine is relatively very low, and Dr. Munoz can speak to more of this. It is quite low. It is certainly far lower than the rate of what can occur to your heart if you get COVID itself, if you get the COVID disease itself. And so the concern for the vaccination, really, while there are reported rates of having what we call myocarditis, or an infection of the heart muscle that is associated, we don't actually understand it exactly, but it can be associated with the vaccine. It can actually be associated with any vaccine. It can actually be associated with any infection, any virus. And as a matter of fact, the rates of those infections in vaccines are extremely low. And so anytime that anything is reported, certainly it's investigated and it's looked further into. But I will say, if you're looking at risks and benefits of not vaccinating versus vaccinating, if you do not vaccinate your child, we're talking about teenagers again, the rate of getting the multi-inflammatory syndrome in children, which is MIS-C, which is a very severe reaction to having had COVID, is about 1%. The rate of having a heart infection is about 5%. The rate of having long COVID or having long-standing symptoms from COVID is about 10% in teenagers. And so if you look at all those numbers and you look at the rates of having an adverse reaction to the vaccine, which is much less than 1%, then it's clear that what is occurring in terms of if there's any adverse reaction, it is very, very, very low. And certainly anyone who's had an adverse reaction, we take it very, very seriously. They are treated, and there have actually been no poor outcomes from those adverse reactions, like I said, which have been very, very low.
I appreciate that. Thank you very much. Dr. Munoz, in the same context, is there a concern about the COVID vaccine changing the fertility or the hormone levels or making ADHD more prevalent or more likely in teenagers?
None of those, absolutely. And the reason I can tell you that with certainty is because there's one thing the vaccine is doing, and that is to stimulate your immune system to develop antibodies, which is protection, antibody-fighting proteins against the virus. The vaccines, because there are different kinds of vaccines, are made so that it's not the actual virus, so you cannot get infected from the vaccine. You have the option to have different ways of presenting that portion of the virus that stimulates the immune system, and that's what differentiates the vaccines. But the vaccine antigen itself, which is what makes your immune system react, tends to stay in the place where it gets injected. That is important to know. It doesn't tend to travel across your body at any significant rate. The cells that are meant to be stimulated are local, and then they develop the protection right away. And we certainly have seen some reactions that occur normal to any vaccination. That is expected, that you would have, again, a local site, a local injection site reaction where you could have pain or you could have some swelling, redness, etc. This is exactly what your immune system is doing, is trying to go and attack that piece of the virus, or mimicking the virus that is there to stimulate your immune system. But there is potentially an inflammatory response as well. Again, the virus it usually causes that with the actual real disease, so something that mimics the infection will cause something similar as well. But this is, again, a natural response. And so the fact that we have now, again, such surveillance and such high numbers of people vaccinated is what allows us to identify potentially rare events that could occur. And as Dr. Lopez mentioned, we certainly have seen well described some of these side effects with flu vaccine, for example, in the past, with the smallpox vaccine, with some of the live vaccines like measles and chickenpox vaccines. So it is something that is known. For the most part, there are not unusual reactions that have been reported. And then some of those hormonal changes in fertility and things like that are really unfounded at this point. I think they come from maybe concerns that have been raised by those who might not really understand exactly how the vaccines are working.
Well, thank you very, very much. If we can just for a moment, we may come back a little bit to the vaccines, but maybe why don't we turn for a moment to the concept of masks? What are the current, Dr. Aguayo, the current CDC recommendations for wearing masks for adults who have had the vaccine?
Great question. Let's first define what a vaccinated adult is. You're considered vaccinated 14 days after you've received the second dose of either Pfizer or Moderna vaccine, and 14 days after your single and only dose of the Johnson & Johnson. Everyone else is considered unvaccinated per the CDC guidelines. So vaccinated people are now allowed to do most of the things they were able to do prior to the onset of the pandemic. So you can go maskless and you can avoid social distancing if you are going outside to large gatherings, if you are going to shopping centers that are not very crowded, indoor sporting events, if you're going to indoor restaurants, any religious events, any singing in a choir, practically almost any activity that you were able to do so prior to the onset of the pandemic. And it's reassuring. It's like we're moving in the right direction, and the decrease in cases has definitely helped us to get there. There is a specific population which we need to mention, and it's patients that have diseases that suppress their ability to fight off infections, or patients that are taking some medication that, as an effect, it leads to a decreased response to any infections. It is not that we don't know if it's safe or it's unsafe. We just don't have enough information for this specific population. So what we're recommending for these people is to have a conversation with their doctor and determine what specific guidelines, what is safe and what is unsafe for this specific population to do. We just don't have the information, and it's better to play it safe. We also know that the vaccines are highly effective, very, very highly effective, but they're not perfect. So you still have some risk of contracting the disease even if you've been vaccinated. And if you start developing the same symptoms we've been talking about since the onset of the pandemic, fever, chills, headaches, body aches, sore throat, loss of taste or loss of smell, even if you've been vaccinated, you should go back to mask wearing, you should get tested, you should stay home, contact your doctor, and await for further instructions.
Well, I appreciate your answer was so good and so thorough, Doctor. I'm going to give you one more. So we're going to take this in air, and I appreciate that. So the current CDC recommendations for wearing masks for adults who have not had the vaccine.
Okay.
Thank you.
Thank you for that question. Well, the CDC hasn't changed much for people who are not vaccinated. They recommend they continue wearing masks every time they are going to go into gatherings with other people that are not from their household. with very few exceptions. If you are going outside to the park for a run, for a walk, for a wheelchair ride, what have you, and you are not going to be coming in close contact with other individuals, it is safe to do so without a mask. It is also safe to have a small outdoor gathering, say with individuals of another single household who have been vaccinated. Say your cousins have been vaccinated and you are going to meet with them, have a barbecue outside, and your family has not been vaccinated, it is safe to do so only in that case. However, if there will be people from different households who have not been vaccinated, it is recommended that every unvaccinated individual continues to wear their mask.
And of course, what's complicated with all this is you truly don't know as you're starting to go into your daily lives, and whether at the medical center or me downtown or all of us, wherever we are in this great East End where we are here, and thank you once again to Houston Media for hosting us, that we just don't know. So probably, and Dr. Lopez, I'm going to turn it to you. I'm going to ask you a little bit about something mask, but if you don't mind, I'm going to return to vaccines one more time because I still have an itching question. So with the masks, do we just have to be prudent and just make the right decision? Maybe just carry one just in case if we feel that we should put one on?
I mean, I would say that if you're asking your average healthcare provider, many of us continue to wear masks.
I think you guys are above average.
Many of us continue
let's
to wear
ask
masks.
the above average healthcare providers. What would you guys say? Gender neutral.
So part of the reason, I mean, so we work in a children's hospital, and currently vaccines are not approved by the FDA or two of us work for the children's hospital. And so vaccines are not approved for children less than the age of 12 currently. You know, obviously those are studies that are ongoing. And so just because you have a vaccine does not mean you cannot contract COVID. You still can contract COVID. You still can get COVID, even though you will not get as sick because you have the vaccine. That's the whole point of the vaccine. But it does not mean that you cannot pass it along to children because children are not vaccinated. And so part of the reason to continue wearing your mask if you're kind of out and about is to actually protect children. If you have children at home, if you have children that cannot be vaccinated currently, if you're in some sort of a setting where there's lots of kids, part of the reason for that is to protect them, because while you can catch it and have nothing happen really to you, you can then pass it along to a child. And so many of us really do continue to wear masks to be able to prevent the spread to children and frankly to individuals who cannot be vaccinated because they are immunosuppressed. They have diseases that don't allow them to be vaccinated. They have ongoing treatments that don't allow them to be vaccinated, or they have disease processes that don't allow them to be vaccinated. And so for those populations, we continue to wear masks in the event that we contract COVID so that we don't pass it to them. And last thing I'll say is there is data that shows that the transmissibility, the ability for you to give COVID to someone else is much, much lower if you have the vaccine. That is also true, but it's not zero. So
I appreciate that very, very much. May I ask you yet another question before we go to Dr. Munoz? Thank you. Let's talk about, do the children, cognizant that as of yet, not yet the vaccine, but do the children with COVID-19 get as sick as adults and then hospitalization? Perhaps walk us through some of the scenarios and perhaps some of the thoughts as what to do.
So children in general tend to have milder disease processes than adults do, by far, I'd say. And as children get older and as they move into their teenage years, those mild cases tend to become a little more significant, particularly if they have the same underlying medical conditions that adults have. So for example, obesity, if you have diabetes, if you have asthma, if you have high blood pressure, all of those will make you more likely to have a more significant a more significant reaction to getting COVID, and that of course includes being hospitalized, having an ICU stay, and things of that nature. And so kids absolutely do get sick. We have seen it. They don't get sick as often, but they absolutely do get sick, and we saw plenty of them in the height of the pandemic. To Dr. Aguayo's point about the populations that are being most impacted, we also see that the populations that are the most impacted in children are disproportionately Latino and African American. Of all of the cases that were in the emergency room and admitted to the hospitals in 2020, 39% were Latino, 25% were African American. And so it's a disproportionate impact on these populations. One other thing I'll say about this is I cannot go without talking about MISC, again, the multi-inflammatory syndrome in children. It is a rare complication of having COVID. Most children do not actually have any symptoms at the time that they have COVID, but what MISC is, it's actually a response to having the antibodies in your body, so your body starts to attack essentially itself, and those children can become very, very ill. And of the children that have died from COVID, a not disproportionate number of them have had MISC. And so that is a real risk, and that's one that we take very seriously in terms of children getting sick with COVID.
Well, I appreciate that. So all of us wanting to do, Dr. Munoz, we're going to go with you next, and you have to put us back on the spirit of hope. So this is the issue. So then the question is, what are the CDC recommendations and for what you've seen for children who are not yet eligible for the vaccines? So what can we do to protect nuestros hijos, nuestros primos, bueno, the little ones that are not yet eligible? What can we do? Give us some hope and pragmatic solutions.
We are working on it. I can give you that answer right away. There has been from the beginning, and as a pediatrician, also with infectious diseases as my specialty, I can tell you that our community of pediatric infectious diseases physicians in this country have been raising a voice for children from the beginning. So our first wave here in Houston was exactly a year ago in June of 2020. And we started putting out information and pleas, basically, to the scientific community, to the NIH, to the different manufacturers of the vaccine, so that they would start working on pediatric vaccines. We've been waiting for a long time, and here we are. We had already data for teenagers, as we mentioned before, 12 and up, which were groups that started to be studied by the end of last year. And that has given us the opportunity that we have now to look at these vaccines and potentially give them to the younger children. So the studies are ongoing as we speak for the mRNA vaccines in the United States to include children as young as 6 months of age to the 11 years of age, so that we have coverage for all the age group that we need to cover. Children are amazing. Children have a wonderful immune system, and they don't need as high doses as the adults do of the vaccine itself. So we're able to fine-tune and prepare vaccines that are specifically the best, the optimal for the child's immune response, and to be safe for them as well. So these studies are very hopeful, because we do think that, as we mentioned, children need protection for many reasons. We need to go back to normal life. We need to get them to be with family, to be in school, to do their sports and other activities, and vaccines are going to help us do that. So we have that light at the end of the tunnel. It is expected by the end of this year we will have some approval of the vaccines for younger children. But at the same time, I have to say, and just going back to that topic of hope, we know so much more now. We have so much more information because of all the research and the investment that has taken place from everybody that is involved in the laboratory in developing these vaccines and treatments to literally the people who volunteer for these studies. So I can't, not recognize that we are really where we are because of the community's involvement and the participation in these clinical trials. And lastly, I would say, going back to the topic, what else can we do to protect them, to take care of our children? We do need to take into consideration that as we cover more adults and older adolescents with the vaccine, those that are susceptible are going to be those who are not vaccinated. So the young children, but also people whose immune system is not allowing them to have the best response to the vaccine, those who, for different reasons are not able to get vaccinated. So we do need to keep in mind, one thing that we have learned from the pandemic is that these methods work. Having a mask on, washing your hands, having some kind of distancing. Children get COVID, but they also get other viruses. And we have seen those viruses disappear. Nobody that I know had flu last year. We are seeing a little bit of an uptick again of some respiratory viruses, especially one called respiratory syncytial virus in children, which is very unusual. And we're seeing an outbreak right now in the middle of the summer, while this is usually a winter virus. So it tells you how, as we relax our measures of protection, we are seeing the circulation of these viruses again. So we are very hopeful that we know more on how to prevent these viral infections, and we just continue to implement, to use these strategies to protect our children in the future.
Well, that was a great answer. And so obviously we have to be hopeful, but we have to be pragmatic. We have to play it safe. And I saw you moments ago in the studio. You have your mask, trusty mask, ready to go. And it's good. You referenced the potential for light at the end of the tunnel and perhaps at the end of the year. We won't hold you to it, but we'll be optimistic. And there's no doubt we have to keep washing our hands, and if we need to play it safe, to do so. We appreciate that very, very much. I'm going to ask you, Dr. Munoz, one other question within the vaccination space and then turn it to Dr. Aguayo. One, in terms of, we haven't discussed this specifically, so who's producing the vaccine for the teenagers, and are these companies to be trusted? Perhaps, point of differentiation between the adult one. Whatever you are able to discuss on that subject is probably something that the audience would want to hear. Thank you.
Absolutely. So vaccine production, vaccine development in the United States is really stemming from research that occurs at institutions that have a long-standing history of research, such as the National Institutes of Health. Oftentimes, there are groups, academic groups, or even biotechnology groups that have been working on this type of vaccine development for a long time. But the real capacity to bring vaccines to us, to the public, comes from vaccine manufacturers who have that experience and who have the production capability, that they are able to go and take a vaccine from the laboratory to the community by going through a very rigorous process of testing, of proving that they're able to produce it in the with the standards of quality and of safety that our regulatory agencies require. And all of this has happened because of a tremendous investment, not just a financial investment, but in time and dedication, personnel, making a priority the development of vaccines. So are they to be trusted? Yes. We have to trust the system that we have in place. We are, as I mentioned before, fortunate to have the best vaccines in the world because we have the highest standards of developing vaccines in the world. And this is why we have only 3 vaccines currently approved under emergency use utilization in the United States, while you probably have heard many other vaccines are available in other countries with maybe not the same rigor as we have here. The concept of the life of a vaccine is also important to keep in mind. It doesn't begin when we start hearing about the clinical trials. Vaccines begin developing many years ago in that research that occurs in National Institute of Health laboratories, academic laboratories from the beginning, bringing it to a reality. And then it doesn't end where we are right now when we are already using the vaccine. There is also a post-implementation surveillance, quality checks, a number of events that continue to happen as the vaccine is utilized. So I think we have all learned a lot about how vaccines are made and the process that occurs over time. And that should give us confidence. That should give us more assurance that things are being done in the right way with a high priority for the health of the population. And vaccines do that. There's nothing else in medicine that can do that. And we are seeing it today because we are seeing back to life, back to normalcy. Yet I would urge us not to go to the old normal, but to a more educated normal, a normal where we can make a difference and continue to build from what we've learned.
Absolutely, a new normal with hope and aspirations, but aware of the past. So there are three that have survived all the stringent efforts that have been done. Are the same 3 of the ones available for the teenagers as well?
No, currently we have actually only two vaccines available for teenagers, right? So the Pfizer vaccine is available for children 12 and up. The Moderna vaccine has also shared some data for this population, but the Janssen vaccine, which is a different type of vaccine, is only for adults at this time.
Okay. And before I turn to Dr. Aguayo, because I actually then want to pivot to another subject, perhaps Dr. Lopez, I don't know if you have this information readily available in terms of if someone wants to vaccinate, if I'm an adult that have not yet had the chance to be vaccinated, or if I have a teenager that wants to be vaccinated, what are opportunities out there? Do you have a sense of where they can go?
There are so many places that you can go. It is actually very exciting to see so many opportunities, so many places. There are several hospital systems that if you're a patient at that hospital system, you can go to the hospital system. NRG has had, the NRG Stadium has had vaccines available for quite some time. If you go on the city's website, the Houston City's website, there are plenty of places and lots of information regarding where you can get a vaccine. There are vaccines that are available at your local pharmacies that are readily available, easily available. There are vaccines that are available at oftentimes at your primary care physician's office. So there used to be an issue with acquiring a vaccine because it was in such high demand. That is no longer the case, and so you can pretty much get a vaccine anytime you want to in the city of Houston.
Well, which is a true luxury, and given that the impetus for this was the Mayor's Hispanic Advisory Board, perhaps start with the city website and see what else. We appreciate that very much. And again, we are just fortunate to also be in Houston, where we do have the Methodist Hospital, Texas Children's, Ben Taub, and all these other, and of course, Baylor College of Medicine. I have to confess, my father's been at Baylor and Methodist for 40 years, so quite proud of the medical center. And actually, my other brother and my sister are also involved in medicine as physicians, so quite proud to be associated. Turning just for a moment, if we may, Dr. Aguayo, because often it's an issue of some of the factors that may have some aftermath with COVID, being overweight or having diabetes or high blood pressure. What are other situations like this that will make it a little bit tougher to do perhaps not as well with COVID if you happen to be whether overweight or diabetes or high blood pressure? And then what can we do?
Of course. Those conditions that you mentioned are extremely prevalent. Even here in the state of Texas, it's more prevalent than in the rest of the nation. Those are just a few to mention that are very common, but the list goes on. So any history of any lung diseases, chronic obstructive pulmonary disease, pulmonary fibrosis, pulmonary hypertension, cystic fibrosis, any history of cigarette smoking, whether current smokers or past smokers, those populations are at increased risk. Anyone, as I mentioned earlier, who has any condition that weakens their immune system, their ability to fight off infections, or that takes medications that, as part of their effects, cause your immune system to not work appropriately, those people are at increased risk, which includes people who have received any organ transplants. Anyone who gets a heart or kidney or a liver as a transplant is going to be, for the rest of their life, on some medications that cause their immune system to be suppressed, making them more likely to have a severe course if they contract a COVID-19 infection. Patients with HIV and AIDS, people with heart disease, whether heart attacks, congenital heart disease, people with chronic kidney disease, chronic liver disease, and pregnant women are all at increased risk, and they should make it a priority to get vaccinated. It is safe. It is highly recommended that these people get vaccinated. So what can we do about it? Get the vaccine as soon as possible. Follow the guidelines of unvaccinated until you are fully vaccinated. Once you are fully vaccinated, you can go to follow the guidelines for the vaccinated people.
I appreciate that, and I know we discussed this at length, but given if you're an adult that has teenagers and you are living with some of those conditions, it would make a lot of sense to go ahead and have your teenager vaccinated as well, because you are more susceptible to some of these issues, and if you can surround yourself with others that are also vaccinated, I suspect that's an ideal situation.
Yeah, you're 100%, you're absolutely correct. If there's less people to contract COVID outside of home and bring it home, the likelihood of you contracting the disease decreases substantially.
Oh, I appreciate that very much. We've got about 10 to 15 minutes. The last few minutes, we're going to wrap it up with a little bit of hope and some of the opportunities that can come with all this. What I would just like to hear from a little bit from each of you is just whether it's been asked or not, solicited or unsolicited advice or thoughts. And perhaps, Dr. Lopez, one of the things that returning to the epidemic within the pandemic, I do worry tremendously because although we are, somewhat, we've got COVID in the rear, not completely rearview mirror, there's still a lot of economic suffering. There's still a lot of unemployment or underemployment or concerned about going to your employment and being affected because we truly don't know if someone's vaccinated or not. We have to take their word, but mask up if you have a question, lather up as well. So if someone needs just a little bit, not just the vaccination, you talked about that, but just needs a little bit of just mental peace, what can we do? Where should we go?
I think the first step in that whole process of mental peace is recognition. So recognizing that it is okay if you don't feel okay. That is very okay. And I think in a lot of communities, depression, anxiety, and things of that nature are shunned, or any sort of mental health disorder are shunned. People don't want to talk about it. It's embarrassing, or it is people have some sort of a stigma against it. And I think that the first step is recognizing if you don't feel okay, to say, I don't feel okay. And that's okay. And there are plenty of resources for that. I think it's important to recognize, since a lot of what we're talking about is teenagers, what a lot of teenagers have been through. A lot of teenagers have missed their senior year. A lot of teenagers have lost a family member. I think there's a statistic that says that anywhere between 17 to 20% of children in the United States have had a premature loss of a parent because of COVID. And as a matter of fact, of those, 75% of those were teenagers. And so there's a lot of reason for teenagers to have mental health issues at this time. And it's really quite appropriate to ask them, how are you doing? To check in, to have a discussion with your physician, particularly if you see behaviors that change and say, I'm really, really worried my teenager's not eating, or they are sleeping 15 hours a day, or they are not doing what they used to do. It's one thing to say things have changed because of COVID and people don't feel like people cannot do the same things because of COVID, but it's another thing to have a disinterest in some of the things that you used to have an interest in, and that's a very clear sign that something else is going on and that it should be discussed. So there are plenty of coping skills that we work with our teenagers on, teenagers who have chronic disease processes. We teach them coping skills in terms of recognizing when they're stressed or when they're depressed, and then having discussions with their doctors or with a trusted friend or with their parents about how to get help for that. And again, there are plenty of resources in Houston for those populations. And I'm going to say this one more time. www.crisishotline.org is a really great resource of a group in Houston that specifically works with individuals that are in crisis. And it's a really, really great resource for individuals of all ages, teenagers and adults alike.
Actually, go ahead and say it one more time, please, because we do need to emphasize it is okay not to be okay. And whether you're a teenager, you're an adult, we all have our moments. And the reality is we just may need to talk to someone. Un minuto hablar con alguien. So please, the website one more time.
The website is www.crisishotline.org, O-R-G.
Dr. Lopez, the statistics that you referenced about the numbers that have lost prematurely a parent, up to almost 20%, that's flabbergasting, and 75% of which would have been teenagers. That is incredibly difficult. Thank you. Dr. Munoz, I welcome a bit more on what she's discussed, because I think what's also important as we get into the summer months with teenagers, you don't have necessarily, to the degree we were able to go back to school and it wasn't just Zoom, you don't have the advisor there. You don't have the extra set of eyes of the teachers. We are all as adults trying to make a living. Some of us have one job, some of us have two. Some work at night, some work during the day. And there's a lot going on. Give us a little bit of your thoughts as to what we should do, whether for ourselves, for our teenagers, or even our children. I think we're all susceptible.
Absolutely, we all are. And we can continue to expand on some of the effects. You know, you refer to academic implications. So indeed, there could be consequences from not having learned what you had to learn in the last academic year, not being prepared for college for some of our teens, not having had the appropriate skills developed to be able to then go on, not just in college, or to actually take a job or take positions that would offer opportunities. So I think this is one of the concerns we have, is just the missed opportunities and the implication that the pandemic has had in our young people taking advantage of probably a very critical time in their life where opportunities come, even if it's about connection, about having interactions with people of their own age that then can feed ideas, and they together bond as a group and they grow together. You know, all of that, we've had a big loss, a big gap during this period of time. You mentioned loss of parents. You know, there is also loss of grandparents, and in many Hispanic communities, especially as you know, grandparents and the family unit is really important for those children, which they learn from the grandparents, but they also have that support. The entire family structure has been affected in many families because of that. So we, I think, are going to face probably repercussions of this for a good time to be, until we are able to strengthen our homes, strengthen our families, and our support systems around. If we've been fortunate to continue to have an education, that is great. Some have not had that opportunity, or hold a job, or hold a position that will allow them to take the next step. But I think, on the other hand, you know, humans, we people are very resilient, and we have faced through history similar situations in the past. Again, being an infectious disease doctor, we can go back in history and look at all kinds of plagues and pandemics and events that have threatened our existence. And we should take care of our health first. And I agree 100% of our mental health, but also think about our physical health. We need to be healthy. We need to eat well. We need to exercise. We need to walk. We need to be outside. And that strengthens us incredibly. And hopefully, this has been, again, with a little bit more time in our hands, a way to think about how to manage our daily life, prioritize us, prioritize our families, and not just our very crazy lifestyle that we used to have, going from one place to the other. We know technology works, so Zoom and long distance events and all of the technology that we have used, we have to keep using that to our advantage as well. So again, many opportunities have been lost, but many have been created, and we need to capitalize on that.
Wow, that was just an incredible amount of amazing things stated. I'm going to do a little synopsis, say a couple of things, and then turn it to Dr. Aguayo to give us closing, and then I will thank all the committee one more time. So much of what you said. First of all, there's no doubt a little Zoom, a little bit of this. However, to the degree that we can get the luxury of meeting and seeing each other, I would say on some of the things that are gratis and free, just even have someone look up the term mindfulness or even happiness apps. Sometimes we just need to have these simple free things, just stop to think and just see what we can do. I would say during the summer specifically, I was thrilled to see that there's so many things online. I think it's called Kuma, and there's all of these different work opportunities in terms of education for the kids. At the same time, you still need to have the chance to run around and do things. So not always be at the computer, but look for things that are gratis, because they're there and they need to be used. I like your concept of, we had this extraordinary chaos, but there is opportunity as a result, and perhaps some things innovative. Before I turn it to Dr. Aguayo and then thank the committee one more time, you referenced resilience, and you're absolutely right. I love the R's. We have to resolve the dialogue. That's why we're here. We talked about the resilience. We have to return to normalcy, though. But as you stated, it's a new normal. Learn from the past, a little bit more hygiene, but we have to reimagine and reform. I'm going to give it to Dr. Aguayo. No pressure. You've got about a minute and a half. So give us your best lessons learned until I then thank the committee. Thank you.
All right, this has been a long journey, stressful for all parties involved, not just the medical community. People's lives have changed. People's lives unfortunately, they've ended. We are on the right track. Vaccines are the most spectacular thing that has happened all year. We are finally seeing an improvement in the cases, but everyone needs to do their part. Everyone needs to get their vaccine, because that is what you can do for your community, for yourself, for your loved ones, and for everyone around you. If you want to return to the new normal, the new educated normal, the only way to do so is if everyone goes out, finds their nearest vaccination center, and gets it done.
You nailed it. The new educated normal for all of us to be vaccinated. Dr. Lopez, thank you not only for all your effort in putting this together with your great colleagues, but serving on the Mayor's Hispanic Advisory Board. Dr. Munoz, it was a treat to get to know you. Dr. Aguayo, mutual. I cannot thank enough, again, Francis Castaneda-Diaz, the rock star that started this whole thing, and we're thrilled. Houston Media Resource for having us. Of course, we've got Rose Salas, who is here today, who is the co-chair of the appointment subcommittee with me, the absolute amazing Lenora Sorolla-Pullman, who again is the co-chair of the Mayor's Hispanic Advisory, along with Roland Garcia. We thank you. This has been incredible. I don't know if you can see it on the screen, but if you can, there's this inspired, there's the inspired montage created by the absolutely amazing Gonzo, who is one of the rock stars of our Hispanic community, a muralist, but really who does a lot more, and he has inspired us. So I encourage you to Google Houston is Inspired and Gonzo and learn about him. Once again, we want to thank you. Please, if you did not get to tune in or you want to see it in Spanish, we'll have a truncated version thanks to Grace Olivares, another member of our Hispanic committee. We'll be back together, Univision, on Thursday. Looking forward to seeing you. In the interim, get vaccinated, keep the hope up. Here's to the new normal, and we are so honored to have seen you and visited with you this evening. Doctors, thank you again.
Thank you, Sophia.
Thank you very much.
Thank you.